Great, in the hot seat. So thank you. I'm going to talk this afternoon about work I've done over the last probably 4 to 5 years in Malawi, which has included looking at a number of community scorecard programs. So like Duncan, talking about NGOs working locally with local government and other local leaders. And like Duncan, not a doer, though I like to think I'm a researcher doer, but following a journey that organisations have been on in delivering programs in different ways and tracking that. The case that I'm going to talk about was largely led by Plan Malawi. So it was Malawians working in a exclusively Malawian sort of led organisation. And I think it's interesting in a couple of ways. Firstly, because the community scorecard process itself is about identifying problems from the bottom up, which I think is an interesting contrast to some of what we've been talking about today. And secondly, I think it's interesting because it's an example of what I've been calling sort of innovation through implementation, in that in practice it took a fairly standard sort of blueprint approach in the design of the program, but in the process of implementing it actually diverged very significantly from that original design, and I think got better results because it did so. So the problem, it was a community scorecard program looking at public services, so concerned with chronic gaps in basic services, particularly for rural, more marginalised communities. As I said, the nature of the scorecard process means you're going into communities, you're talking to service providers, you're talking to district officials, you're talking to local leaders, and getting them to identify the exact nature of the problems that they face. So it's in their own words and as they see them and they describe how they're impacted by them. So the kinds of issues that came up weren't so surprising. You know, there were issues around a lack of teacher housing, leading to a lack of availability of teachers in remote areas. They were women not giving birth in health facilities and suffering complications as a result, a lack of equipment, medicines and so on, but articulated in people's sort of own words. In terms of the sort of the dominant kind of NGO activity in Malawi, I think it's probably fair to say a big focus had been on spotlighting issues. So we have a Stop the Stockouts campaign that says this is a big problem and causes a lot of attention. Not much that really looked at how do you solve problems or what is it that's really driving them or sits beneath them other than resource constraints, which are there but are not the only issue. And you had a lot of, you know, what we tend to call sort of briefcase NGOs, so responding to donor money, donor agendas, you know, agendas like citizen empowerment without perhaps being so connected to realities on the ground in different communities. So, as I said, the community scorecard program that I looked at with Plan was really interesting because all of the program documentation, all of the design was about a fairly standard approach to doing a community scorecard process that sort of envisaged it as a mechanism for strengthening citizens' voice and empowering them to speak out to service providers and getting better service outcomes as a result. So it's a kind of vision of change that was linked to empowering people to speak out, give voice, say what wasn't working for them, and change would happen as a result. But in Malawi, that really didn't correspond to the realities of local incentives, to power dynamics on the ground. So you have a history of competitive clientelism at the centre, which has meant a sort of effective sort of institutional vacuum at local levels, a lot of fragmentation, and service providers are much more incentivised to respond to pressures from above than from below. For citizens, it's not the case that citizens don't make demands in Malawi. They do, but it's often about themselves or their families in the context of patronage relations. It's not about better services for all. And what was interesting was that there was a project lead, you know, a person who was managing the scorecard program, a Malawian who knew all of this and knew that this was the reality that he was going to be working in. And actually was open to therefore trying out some different things in how he implemented the program. And what they found is that through implementation, the core problem that they were facing at the local level was not the fact that you had to get one group, service providers, to do something for another that they weren't otherwise doing for citizens, but it was actually that you didn't have a sort of shared sense of what the collective interests were, of what the collective action was that could be taken to address problems at the local level in an otherwise very constrained, both resource constrained, but also politically constrained at the top context. And so what came out was a kind of an emerging focus on very sort of local problem solving and collective action building. So practically, what did that mean? It meant in places like Kasungu or Malanji, you had, trying to solve this issue like teacher housing. Okay, communities were brought together to fire bricks that could contribute to building those houses, with local chiefs and faith leaders brought in to sort of enforce everyone's participation in that process. Local NGOs were mobilised to come in and provide some of the sheeting and other equipment that was needed. District authorities were mobilised to bring in additional resourcing and some of the contractors to deliver on the project. So it got different parts of the community who are affected by this problem to come together, where otherwise alone one of them was not going to take action. So how did they do this? I think it was a deliberate strategy of this sort of problem solving from below, so getting people to articulate what the problems were and why they were affected by them, and getting them to share that with each other. It was a recognition of shared responsibilities. So for a program that was led by an NGO and was about citizen voice, it actually said, we recognize that citizens have responsibilities as well, and that part of what we need to do to solve problems is about joint burden sharing. So how do we work in that way? It was a recognition about the need to work with what's there, not with the traditional kind of idealized models of who you engage with for citizen engagement. So traditional leaders, faith leaders, other key individuals on the ground who were really making a difference and could mobilize communities. And it was about sort of politically savvy, locally connected facilitators. So local partners, as Duncan was saying, who had the capacity, the skills, but also the connectedness to really broker some of these relationships, and had a long history in doing so. So I think it wasn't sort of managing the politics, it was actually working with the politics as part of what you were doing to deliver good programs. A final word on sort of learning. Interesting that I think that the experimentation came through as a genuine commitment of wanting to see things get better on the ground. And that often, and in some of the cases that I saw, it meant stopping working in communities where results were not happening. So where they realized that actually the local partner wasn't as connected as they thought, or where they realized that local community actually wasn't as invested in the process as they had thought. But that's actually really challenging. I think we should come back to that, because it's very hard to turn around and admit failure and that something isn't working, but also to cut off funding from local organizations who may really need it. And a final point is that, from what I witnessed, what was really interesting was that as much as you had all of this learning, adaptation happening on the ground, the reporting upwards for the funding for the project never captured any of that. So you still had this kind of double speak of your reporting up against this one model of what the scorecard is and the reality of what you're doing on the ground. And we've been trying to work with them to kind of close that gap, but that's a hard process.